Welcome, welcome everybody to today's webinar with Dr. Imran from Pakistan. Today's topic is going to be on nasal polyps. I will be presenting a little bit from a naturopathic perspective, and then Dr. Imran will continue with his weekly shares with us on homeopathic remedies. Today's topic is nasal polyps. So just make sure your microphones are off, and if you have any questions, please let us know. Okay, so I will introduce myself. My name is Ahava McLaughlin. I'm from South Florida. I am a traditional naturopath, and Dr. Imran has asked me to just speak a little bit from a naturopathic perspective today. And so I'm going to explain a little bit how nasal polyps form and some naturopathic remedies to share. So nasal polyps can form from a variety of reasons. The biggest reason really is because there's a constant inflammation and irritation of the mucous membranes of the nasal passages. And so after time where there's constant infection, irritation, buildup, the sacs of the mucous membranes get filled with fluid, and that creates the nasal polyps. This can be caused from, maybe fungal infections, molds, allergies, chronic sinusitis, rhinitis. Any of these conditions can lead to polyps. And so obviously understanding what your source is important. So there's a constant white blood cells to the area to clear up that inflammation. And then when it becomes too much, they get filled with fluid and then they turn into a polyp. So working on figuring out what that root is going to be critical. And then some of the symptoms that people find with polyps are blocked nose, not being able to breathe at night when they're sleeping, added irritation to the mucous membranes, facial pain, infection, snoring, sneezing, all of the above. Okay, so what are some things that we can do topically to help ease the pain while we work with homeopathic remedies to sort of help clear the condition? First off is vitamin C oxygenates the blood. And so this could be very critical and helpful to managing those nasal polyps. So vitamin C is water-soluble vitamin, and it leaves the body within the hour. So it doesn't get stored like a fat-soluble vitamin does. So you can have 1,000 milligrams every hour, or something to that effect, or a couple times a day, or whatever you can do. Make sure obviously it's non-GMO and that it's organic sourced, so that way you're getting a high quality. Another trick that herbalists use is called bayberry, and you could drink the tea 2 to 3 times a day, or you can use a spray and put in inside the tea, and then just spray it up the nasal passages. Another trick, obviously this isn't for the faint of heart, but you could take a straw and take the bayberry powder and sort of blow it up the nose. Obviously just do a little bit up at a time, but doing that for a week or 2 or more, that can really help minimize the polyps. Another type of spray that you can try that has good success is apple cider vinegar with cayenne. We'll sprinkle a little bit of cayenne pepper in there. Cayenne pepper brings heat to the area, so it causes the body in that area where the heat is to for the immune system to deal with it. So that's the reason for that. And then I would add castor oil. So if you don't think you can handle the spiciness, that's okay. So you could just try the castor oil and put 3 to 4 drops in the nose before bed. You can see wonders. Castor oil is very deep acting carrier type oil. It penetrates the deep layers of the tissues, of the dermal layers of the skin. And so this can be very, very soothing and healing for those nasal polyps. Also keeping in mind to eat less sugar, correcting one's diet, finding out what allergies they have, staying away from it, trying to maybe clear those allergies, working on the immune system. And another thing that one can do is a liver pack, a castor oil pack, and that helps clear up some toxins. I always advise go low and slow, maybe 1 hour at a time before bed. Do not wear it all night for the first time that you put it on. You do not want to have a detox or Herx reaction. Those are not fun. So just do it a little bit at a time. Make sure that you're drinking half of your body weight in ounces of water daily. And last thing that can be helpful is serapeptase. Serapeptase is an enzyme that breaks down debris, and that includes nasal polyps. And you could take it on an empty stomach in the morning and in the evening. Serapeptase, Serapeptase. Serapeptase. This is great for especially breaking down debris in the lungs and anywhere in the air, the nasal passages, the airways. Serapeptase is great for that, but it does need to be taken on an empty stomach because it will break down everything else with it, including food that you're eating. So take it away from food, maybe 2 hours away or so. Let me see if there's any other comments. Oh, fresh carrot juice also is great for cleansing the mucous membranes. Let's see. So that's good to get in if you can get in daily. And I think that is it for now for me on my end. If anybody has any last minute questions before we go on to Dr. Imran. I can't imagine that these things are fun. Some of them can grow quite large where they're hanging out of the nose. So if you have clients dealing with that, using some topical remedies like this could be very helpful and soothing. While, you know, you could also integrate the homeopathy portion that we're about to hear. Okay, so I don't see any other questions.
I have one.
Okay.
If a real quick one. Oh, gee, what was I going to say? Oh, the castor oil packs. We could probably Google that and figure out how to use it. Just a simple yes or no works for me. Probably we can just Google it, right, to figure out how to use the castor oil pack. I've read about
Sure.
it.
So it's a huge craze right now. I've been doing these for a long time, and it's like really blown up recently. What you want to do is you want to get a piece of cloth, or they now sell them where they have Velcro, like a panel, like a cloth, and you could Velcro it around your body so it stays put. So it's not so messy. And then you make sure you get castor oil that's cold pressed in a glass jar, and you put that on the pack, the flannel or the cotton piece, and you put it over the area that you want to target. In this case, we're saying liver. Making sure that the cloth or the flannel piece that you're getting is organic, because you don't want to release those, like pesticides, like from regular cotton or anything like that, or dyes like back into the body. We're trying to cleanse, not put back in. So it's important to make sure that the cloth that you're getting is organic. Also, you would start like for about an hour so that you make sure that there's no detox reaction. And if you go for a couple days and you see you're fine and you're tolerating it well, then you move up maybe 2 hours. And you could do this to any part of the body, but I always caution to go low and slow when you're starting this, because some people have a hard time detoxing and they need to open up drainage pathways, which is another conversation. So some people need to really take it easy when they do that. Hopefully that answers your question.
Yes, thank you very much.
Okay, good. And will colloidal silver, yes, that can be helpful. It can be helpful, especially, I'm trying to think, like it does heal like blood and clots and stuff like that. So it can be helpful. And it also, if you're dealing with mold or fungus, and constant irritation in the nasal passages, the colloidal silver can kill any, pathogens there. So maybe doing a neti pot with colloidal silver can be helpful as well to kill off whatever, bacteria and different things that are causing the irritation to the lining of the mucous membranes. So that can be a good option as well. So is there a question about oxalate buildup from taking lots of vitamin C to help with this condition? So first of all, I want to say everybody's unique and different, and what works for most people, sometimes there might be a small percentage of people that it does not work for. I have used high dose vitamin C therapy personally in my life, in my family, and my clients, and I have never seen this issue. Could it happen? I'm pretty sure anything is possible. So if you tend to feel like, you just try it and see how you feel. You have an oxalate issue. I just personally have never experienced someone not being able to handle vitamin C. Actually only one client, and that's because she had her whole drainage pathway system was completely closed. But it was a lot of severe issues. Usually the average person can tolerate vitamin C, and especially in acute dosing where it's like short term. So that, again, it's a general rule. Good question.
It's live. Yeah.
Any other questions? Okay. All right, so I'm going to pass it off to Dr. Imran.
I have one more question.
Yeah, sure.
Regarding the colloidal silver in the neti pot, so sometimes my son's nose is completely blocked where no liquid can get through at all with the neti pot. Do you think maybe just spraying colloidal silver up there would help?
Yeah.
Nothing can get through?
Do a colloidal silver, they sell them in the nasal sprays where you push down and it goes up. Now what you could also do is nebulize. So you could nebulize the colloidal silver and have him take really nice deep breaths as he's doing it. Put him on it for like 15 minutes at a time, a couple times a day, and it really should start opening it up so that way you can maybe do a neti pot or, do something else. But I love nebulizing colloidal silver. It's my favorite.
Okay, thank you.
You're welcome. Okay. All right, Dr. Imran, thank you so much for hosting today. We are excited to hear what you have to say on nasal polyps and homeopathy. If anybody has questions, feel free to post it in the chat or open up at the end to ask questions. Welcome, Dr. Imran.
Okay, thank you very much. Bismillah ar-Rahman ar-Rahim. Good afternoon, everyone. Here is Dr. Imran from Pakistan. So today we talk about nasal polyps. So first I want to share, why do you get nasal polyps? Are there any risk factors that run to this condition? The exact cause of nasal polyps is not yet clear. However, risk factors that chronic nasal infection or sinusitis and nasal allergies play an important role in making one prone to nasal polyps. It need mention here that not everyone with the above risk factor will develop nasal polyps. Even thought they would be likely to develop the condition, various other diseases that are associated with nasal polyps are asthma, fibrosis, chronic sinusitis, allergies, fungal infection, and aspirin sensitivity. How do you know you have nasal polyps? There are several symptoms unique to nasal polyps. The most prominent among these being a stuffy nose. Other signs occupying the nasal blockage include breathing through the mouth, loss or decrease of the sense of smell, snoring, postnasal drip, sneezing, runny nose, headache, feeling of pressure in the forehead, polyps, there are small in size, show no symptoms at all. What are the medical investigation do doctors propose for nasal polyps? Investigation for nasal polyps include nasal endoscopy, a CT scan, or MRI. In addition to the skin tests to detect allergies factor are also done. What are the various type of nasal polyps? There are two type of nasal polyps. These are so sinusitis can nasal polyps. Yes, sinusitis, inflamed mucous membrane of paranasal sinus can lead to nasal polyps. Sinusitis is one of the major risk factors behind nasal polyps. However, all cases of sinusitis do not lead to nasal polyps. Why only a few having sinusitis develop nasal polyps is still a matter of study. Are nasal polyps related to allergies? Yes, they are related to allergies. Recurrent nasal allergies cause of the mucus lining of the nose. So now I want to talk about some homeopathic remedies which help in nasal polyps. Homeopathy can treat nasal polyps. Nasal polyps are considered a case for surgery under the conventional mode of medicine. However, homeopathy offers an alternative by treating nasal polyps internally without intensive procedures. Homeopathy treats the symptoms of nasal polyps as well as help shrink the nasal polyps. These medicines, which are both natural and safe, attack the disease at the root and set off the body process for complete treatment. Some top related homeopathic treatment nasal polyps are: first remedy is limna minor. First remedy is limna minor. Limna minor is one of the top grade homeopathic remedy for nasal polyps. Limna minor works where there is obstruction of nose and loss of smell from nasal polyps. A purulent smell in the nose may also be felt in some cases. Thick yellow-white discharge from the nose is another attending feature. In some cases, nasal discharge. So we are use limna minor in mother tincture, limna minor 1x, limna minor 2x, limna minor 3c, limna minor 6c, limna minor 30c, and limna minor 200c according to the patient condition. So second remedy is Teucrum marum verum for polyps with nasal blockage.
Could you repeat that?
Teucromarum is a most wonderful remedy for nasal polyps with marked nasal blockage. A unique symptom is obstruction of the side of nose on which the person lies down. Loss of smell is also noted. Crawling sensation in the nose may arise. Teucromarum is also one of the best remedy for ozena. Ozena is chronic of the nasal mucosa resulting in its atrophy. So we are use this remedy in 3C, 6C, 200C, 1M according to the patient condition. So third remedy is sanguinaria. Sanguinaria shows watery nasal discharge or burning nature. Other features are pressure over the root of the nose, plugged sensation in nostrils, enlarged nasal sneezing, and yellow bloody mucus discharge from the nose. So we are use sanguinaria in 200C, 30C, and 200C according to the patient condition. Third remedy is Kali nitricum. Third remedy is Kali nitricum. Kali nitricum is addition to right side nasal polyps or with nasal obstruction, sneezing, loss of smell, and dinging pain in nostrils. Dinging pain in the nostrils. We are use this remedy in 30C and 200C according to the patient condition. So fourth remedy is Calcarea carb. Fourth remedy is Calcarea carb for left-sided nasal polyps. Calcarea carb is an extremely suitable remedy for left-sided nasal polyps. This remedy is given to person who complained of blocked nose on the left side. Other attending features are fetid smell and yellow discharge from the nose. In the morning, dryness in the nose may be felt sneezing. Markedly in the morning time may also tend person giving Calcarea carb tend to catch a cold easily with the slight changing in the weather. We are use Calcarea carb in 6C, Calcarea carb 12C, Calcarea carb 30C, and Calcarea carb 200C according to the patient condition. Next remedy is Allium cepa. Allium cepa in the case of nasal polyps with constant sneezing, Allium cepa offers the perfect treatment and attending feather in the watery discharge of burning. The nasal discharge crowds the upper lips. Headache may also persist along with fluent uh, coryza. Some feel there is a lump and the root of the nose. Nose stopping may also be observed. So we are use allium cepa in 30C, allium cepa in 200C, and allium cepa 1 m according to the patient condition. Next remedy is Kali bichrome, Kali Bic. Kali Bic for post nasal discharge in nasal polyps cases. Calibic is nasal polyps cases. Calibic is selected the post-nasal discharge in thick, lumpy, ropey in nature. It is attended with much hawking, marked pressure at the root of the nose. Is complaint of a fetid smell from the nose is another concern. Violent sneezing in the morning time may occupy the above figures. Calibec is also prominent medicine for treating nasal polyps from chronic sinusitis. We are use Calibec in 30C, Calibec in 200C, and in 1 m according to the patient condition. Next remedy is phosphorus. Phosphorus for bleeding nasal polyps. Phosphorus is a very effective remedy for nasal polyps that bleed easily. Apart from the bleeding, the condition is accompanied by chorea with dull headache and sneezing, which rosen with strong odors. Blocked nose early in the morning is a sure sign that phosphorus will work also in cases where coryza and dryness of the nose alternate. Phosphorus is the best remedy. So we are use phosphorus in 30C and phosphorus in 200C according to the patient condition. So next remedy is conium mec. Conium mec is another effective remedy that is very helpful in nasal polyps. It is indicated when there is tumor growth inside the nose and cause nasal obstructions, breathing problem. This remedy especially act on the glandular system and help in reducing the enlargement of the gland along with nasal polyps. Patient also complain of nosebleed and soreness of the nose. We are use conium mac in 30C and conium mac in 200C according to the patient condition. So next remedy is nitric acid. Nitric acid is selected for its special seat of action, the outlets of the body where the mucous membrane and skin meet. It is very effective in nasal polyps treatment. Patients feel a sensation of a splinter in the nose that causes nasal obstruction, is very painful and breathing becomes difficult. Green mucus releases from the nose every morning. Patients also complain about bleeding nostrils. We are use nitric acid in 30C, nitric acid in 200C, and nitric acid in 1 m according to the patient condition. Next remedy is calcarea iodide. Calcarea iodide is very effective in cathral condition. It is a very beneficial remedy for treating nasal polyps due to cathral condition. This remedy is indicated when this secretion from the nose in profuse and a yellowish color, patient are subject to catching a cold easily. Patient also suffer from allergic, which include frequent sneezing, very little tension in the nose, reduced smell. So we are use calcarea iodide in 3x, calcarea iodide in 6C, calcarea iodide in 30C, and calcarea iodide in 200C according to the patient condition. Next remedy is thuja. Thuja is an effective chief remedy in formation of wart like upon mucus, sore face. Thuja is another effective remedy that help to treat the nasal polyps. The patient also complain about the dryness of the nasal cavities and ulceration within the nostrils and painful pressure at the root of the nose. Thuja we are used in mother tincture, Thuja 1x, Thuja 2x, Thuja 3C, Thuja 6C, and Thuja 30C, Thuja 200C, and Thuja 1M according to the patient condition. Now I want to share some protocol which I use in my clinical practice. So my first protocol is Medorinum 200C every Sunday 1 dose, Medorinum 200C every Sunday 1 dose, Limna minor 30C, Tucrum marum virum 30C, and Thuja 30C. Mix together these three remedies and use 3 times a day. And my second protocol is Phytolacca berry 30C, Phytolacca berry 30C, Beta carb 30C, and Conium mac 30C. Mix together these three remedies and use once a day. And third protocol, which I use in my clinical practice, a biochemic cell salts. Calcarea floor 6x, Calcarea floor 6x, Silesia 6x, and Ferrum Phos 6x mix together these three biochemical salt salts and use 3 times a day. Third protocol is Bacillinum 200C, Influenzum 200C, and Diphtheria 200C mix together these three remedies and use once a day. If
Could you repeat that?
anyone, one second, I write in comment box.
And how many times a day for that?
Once a day.
Okay. Thank you.
Welcome. So anyone have a question about this topic? If anyone want to ask question, please on your mic and ask a question.
So on the first protocol, it was Metarhinum 200C, Thuya 30C, and then what was the second one?
Limna minor 30C, Antiucrum marum virum 30C.
Was that Docamara?
I write in anyone have another question?
Yes, Dr. Imran, thank you so much for all this wonderful information.
I have a question. It's not necessarily on nasal polyps, but sometimes in children, you see a lot of nasal bleeding because they have like what they call like a fat, juicy vein in the nasal passageways, so they easily bleed. Do you have a thought or recommendation? I was thinking phosphorus, but I would love to hear what you think.
Millifolium 30C and phosphorus 30C mix together these two remedies and use 3 times a day. In case of emergency, you repeat these remedies every 10 minutes, one dose.
Okay, is this how you spell it? I put it in the text box, the first one.
Millifolium 30C. Yes, correct. And phosphorus 30C.
Okay, thank you.
Welcome.
And would that be taken once a day?
For nasal bleeding,
Yes.
need to use these remedies 3 times a day. In case of emergency, need to repeat every 10 minutes, one dose.
Will this, could you use this long term to help strengthen the tissue around the vein so that it stops bleeding? Or is this just for acute cases?
Actually, these two remedies only help for stop bleeding.
Is there anything that would help strengthen the tissue there so that it doesn't get so it doesn't bleed as easily?
I have the same question because there's certain supplements that will cause my son's nose to bleed, like vitamin D, any of the blood thinning supplements. And I assume it's because of the polyps in the tissue that's gotten thinned out there.
Actually, I see your son nose peak. Both side of nose have a polyps. So her nose bleed, I think, because of polyps. So millifolium and phosphorus 30C mixed together and give him 3 times a day if nose bleeding. And you need to start another protocol which I suggest medorinum 200C once a day and limna minor 30C, teucramarum 30C and thuja 30C. Mix together these 3 remedies and give him 3 times a day for nasal polyps.
Okay, thank you.
Okay, always welcome. Anyone have another question?
Yes, in the case that I was asking where it's not a polyp, but it's just very thin tissue, is there something to help strengthen that area long term?
Okay, so if not polyps, then you need, if not nasal bleed, then give him millifolium 30C and phosphorus 30C. And second remedy is sulfonam 200C every Sunday, one dose. I write spelling in comments. Millifolium and phosphorus 30C and sulfonam 200C every Sunday, one dose. Datagar, I did not see any result in nose, but Betacarb giving a good result, tonsils, in throat, mind symptoms. But in my clinical practice, I'm not see any result in nose symptoms. Anyone have another question?
On the second protocol, it was phytolacca, conium met, and what was the third one?
Okay, so in second protocol, Phytolacca berry 30C, Conium mac 30C, and Branium carb 30C.
What was
Mixed together,
what was the second one?
mix Conium mac,
And then the one after that.
Branium carb.
Oh, okay,
Branium
thank you.
carb or Beta carb, yeah, is the same. So mix together these three remedies and use twice a day, one third. First use twice a day. Anyone have a question? I want to say thanks to everyone. Next Sunday, we meet again, same time, and different topic. So I want to say thanks to everyone and God bless you all.
Thank you so much, Dr. Imran.
Welcome.
Thank you very much.